You know, I think that there needs to be an element of forgiveness in what's gone down. However, I don't see a course correction happening fast enough. And I do get the sense from him that he's trying to defend the indefensible. And instead, what they should turn around and start saying, listen, we did the best we could at the time. We're going to course correct quickly. Instead, we're locked in a ridiculous discussion around, at the moment, around what kind of winter clothes we can buy, when what we should be talking about is how do we make the public transport networks as safe as possible? How do we put regulations in with the taxi drivers, the bus drivers, to get them there? What does proper food support look like within communities, and how do we monitor it? Those are the discussions we should be having, not these policy discussions which are taking us nowhere and just leading to endless newspaper centimeters space.
I guess so. And also, I guess what it shows us is that we live in the social media age. So it will be crop bottoms and cigarettes and alcohol, which run what should be a much deeper public policy debate. For you, Sha'ista, from Miller Harding, in fact, to all panelists, in terms of taking another loan from the IMF, could we not instead consider advocating for debt cancellation? Are you there, Sha'ista?
Yes, I'm here. I think, you know, at the moment, the IMF is cancelling debt for very poor countries. I don't know that South Africa fits within that category at this stage, but my understanding is what they are being provided is a very low rate loan, which is cheaper than what they'd get on commercial markets. So I think, I mean, historically, the concern with the IMF is that they come in and they put structural adjustment policies, which take away a country's ability to choose its own policy. And with austerity, this often had very significant impacts on the poor and on the country's ability to build up certain industries. But here with a non-conditional loan, I think that's quite a different type of IMF loan to that previously. In terms of the debt cancellation, I think as a sort of middle income country, our standing is a bit sort of weaker than the very poor countries who are actually getting the debt cancellation, just in terms of the international structure of things.
Thank you. So now I would like us to move into futurescaping. Maybe it's a little bit too early to start doing that, but I do want to read that beautiful Arundhati Roy quote, which for me has become the vision of this pandemic. She wrote, obviously, historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It's a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our databanks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. Umunyana, if I could ask you here, you said that this is a moment for a potential reset of our health system, and obviously Section 27's big work now is in being a voice for the National Health Initiative or for national health insurance. What do you think? Do you think that this pandemic is laying a basis for such a system to be created without all the voices against it, which we'd heard since the white paper came out?
Thanks, Ferial. I really like this Arundhati Roy quote. And for me, getting ready for this fight is the fight about inequality and addressing inequality. We've been working on this for decades. And for us to now have a reset button where we have the Minister of Health completely engaged in issues of inequality and building up a health system, I think is an important opportunity for us as activists in the health space. And to have these conversations about national health insurance and universal access in this context, I think is important because it's really laid bare, this crisis has laid bare the inequality in the health system. And we know that we have a private health system and a public health system, and that the public health system caters for about 80% of the population. And what we really need to do is move the needle on inequality in the health system. And that will have an impact in other areas of society. And I think we've always worked on healthcare and health systems because we know that if you unlock this right, it unlocks access to other rights. It enables productivity, it enables education, and it certainly impacts on the economy. And for us, I think we have to have these conversations, and there's an opportunity here to engage with an engaged government. We've had moments, as Thabang said earlier, where government actors were completely disengaged with the struggles of the poor. And textbooks is one example there, HIV is another example. But we have to think about what a capable state is in this moment. And we have a weakened economy already. We're going to have this debt that we have to service. And so we have to, as I said, we have to think about how to work together in solidarity. And you may have seen, Ferial, today as well, that yes, the UNAIDS has sent has issued a press statement, which Cyril Ramaphosa has signed onto as well as President of South Africa, amongst other presidents and ministers of health, talking about uniting behind a people's vaccine against COVID-19. And so I think it's important for all of us to operate at that international level as well, and push our governments to demand in the kind of international space where they operate, to ensure that we do have access to vaccines and treatment as it comes online, and that it is affordable. And I think we've seen that COVID can devastate economies, and we can't then say to governments like South Africa and other African countries that have to compete with rich countries for PPE and for any kind of treatment. So we have to ensure that our interventions as activists and lawyers addresses the issues at that level. And intellectual property is another issue that we've been talking about for a very long time. And we should be getting traction on that as well, to make sure that in our country, in South Africa, we're not just issuing patents on any future COVID treatment or vaccine, because that will become then an issue of access in South Africa and around the African continent.
Thank you very much. Thabang, I wondered if you might come in and share with us not only on education, but on anything where you see opportunity in this moment.
Well, I think the opportunity, is having to look and explore at good governance and what that looks like, and how do we support our government in ensuring that. And for me, I like taking, because I'm a lawyer, I always look at Section 195, which really sets out the basic values and principles governing public administration. And I think if our government can take that on, and we as communities, as organizations, enforce accountability, we could see marked changes. Because one of the things that, for example, we've been thinking about at Section 27 is budgeting. So on the one hand, we know that a huge chunk of the infrastructure grant had to be taken out in order for some of these temporary measures to be put in place. Now, on the one hand, you want the temporary measures in place in order to ensure that schooling does happen. But on the other is that you're taking away money from permanent solutions, which would have benefited these schools in the long run. And so it's about how do we then create a conversation to ensure that we're thinking carefully about these solutions. And at the same time, ensuring that there's good governance, accountability, proper procurement processes, and building capacity to ensure that there's more accountability and anti-corruption in all our efforts to make South Africa better.
Thank you. From Ghulam Merlini, I'm sorry if I've massacred your name, from MSF Southern Africa. May one of the panelists comment on the ongoing massive repatriation of citizens from the region and the encampment of people living homeless in South Africa? Are public health concerns backing up xenophobic, nationalistic, and securitization agendas. I think that's a follow-up on something you said, Francois, but anybody feel free to have a go at that question.
I'm really glad it was raised, actually, because
Yes.
we are seeing this. And, prior to the coronavirus, the xenophobia has been a repeated problem within government, particularly within the Department of Health. We've had ongoing arguments and fights and discussions about what I think are probably illegal, sort of activities where people have been stopped from having the most basic health care. And we're seeing it reinforced here. You're seeing it in terms of a lot of the legislation that's been pushed is a very xenophobic approach to the food. I cannot understand why only South Africans can have access to food parcels.
Yes.
Hunger is such a universal thing. It just blows my mind. And this is where I think civil society keeping an eye on this government's apparatus is really important, because a lot of this is being used to leverage little political projects that have been ongoing by certain people as we're going along. I even see it in the cigarette and alcohol debates. There's a real moralistic arm of government that's hated cigarette smoking and hated alcohol and all the rest. And they're really good public health reasons to address these. But the COVID crisis is being used to advance these agendas. And the xenophobia one is, I think, probably one of the most odious ones around. I live here in central Johannesburg, and, as many as 30-40% of the population here are Zimbabwean. And people are terrified of going outdoors in case the police actually catch them. And we've had this going even prior to the coronavirus problem.
So there's a couple of things here that I think are important. So people who from other countries who may have been working here, contributing to their UIF, have found that they suddenly can't apply because the only way to do so is with an ID, with a South African ID. Ditto the granting of food parcels. You have to show your ID to get one when it's being distributed through local councillors. So I think a very good question from our colleague from MSF there. Many others, from Sasha Stevenson, Thabang, a lot of the provisions directed at schools in relation to COVID are the kinds of things that should be standard anyway. No overcrowding, hygiene, safe transport, etc. How should civil society and activists approach this or use the COVID-19 response to get longer term improvements?
That's a very good question. And I had to a bit because, currently the way the department strategy is placed is to provide temporary solutions to the schools. So for overcrowding, for example, they're going to provide 400 mobile classrooms. For the sanitation situation, they're going to provide mobile toilets and 3,600 water tanks. But the problem is that these are all temporary solutions and using money for permanent solutions in order to do this. And so part of the problem and part of the thinking we need to put in place as activists is how do we ensure that there's some response to ensure that learning can continue, but also that the money is not taken away from other priorities which have affected schools in the long run. And I think that's a very difficult conversation that we need to have with government. Additionally, a lot of undertakings have been made by the department. And what we know from having worked with the department over the years is that there's very little delivery on those undertakings. And so we then have to play that position of being a watchdog and ensuring that these undertakings are met in order for our learners to be safe in schools if and when they return. And so I think for now, my advice would be that we need to sit down, think creatively and carefully about the implications of some of the choices we are making now.
We've got a letter from 100 parents from public schools, and I would guess it's more in the, I don't know how you call it, the first quintile schools, who are saying they'd prefer to homeschool and keep their young ones at home because they don't trust that the schools will be able to implement all the systems that are in that guiding document. What do you think? And let me just get another question there for you, Thabang. What can we do now to make sure that the short-term, immediate interventions from the state are sustained over a long period? I guess that's also about social grants, eh?
So on the first question,
Yes.
Which relates to, sorry, Ferry, I was just writing the second question down. Can you repeat the first one?
Yes, of course. So that was the parents who are saying that they don't trust that the systems for their children will be implemented as promised, and that actually they prefer to homeschool for the rest of 2020. And these are public school parents. Eh?
And those are good and valid concerns. And as I've said, the department hasn't really taken us into confidence with, for example, one, what is the medical evidence you're relying on to justify reopening schools? What are the kind of interventions that you're putting in place? How do those interventions work? One of those is that they want 40 learners in a classroom. Is this feasible? Does social distancing work in that context? Are there enough teachers to ensure that where learners are 40 in a classroom and not 100 as per usual, that learning will be taking place? Will the 400 mobile classrooms arrive? Because we know that there's a procurement problem in our system. And so those are worthwhile concerns to have. And I think what we expect from government, and I know the Department of Education is going to have a briefing today to tell us about their readiness, is for them to tell us where are those classrooms? Have they been procured? If they haven't been procured, at what stage? And I think as parents and communities, it's about reaching out to the school governing body members who have direct access to other department officials and telling them, what is the state of readiness of your particular school in your community? Do they have the protective equipment? Do they have all of these things in place? And if not, then I think that is when we need to find a way to collate some of this information, and so that the rights organizations are able to take this and take these issues up in particular. So I think up until a point where the Department of Basic Education can assure the South African community that all of these things are put in place and have been procured and are available, it makes total sense that parents do not want to send their children to school. And then how do we ensure that some of these long-term interventions last longer? I think that's also a good question. So we've also been looking at the type of interventions and looking at which ones will benefit schools longer. So, if there's a possibility of doing boreholes in some of the areas instead of water tanks, that's a longer term solution. Are there possibilities of expediting some of the construction that was meant to happen during this time so that you have permanent toilets as opposed to mobile toilets? We know the lifespan of mobile classrooms. How do we ensure that if they're installed, that there's proper maintenance and upkeep of those classrooms for the interim period? So that also means that government must not only work amongst itself, but also work with communities, schools, and teachers, educating them about the use of some of these mechanisms and ensuring that there's sufficient money for them to be properly maintained so that they can last a little longer.
Thank you very much. So from Andrew China, also on our call, Herman Mashaba, who started a new political party yesterday, is openly calling for the kicking out of refugees and asylum seekers. He's planning to run in next year's election in 3 cities. And Andrew telling us that refugees from Rwanda have had their documentation taken away last November. Now they cannot even get food parcels or grants. What can we do? From Maniga Pillay, education is struggling, especially basic education. Interventions are needed and urgent, which is what I think Thabang was saying. And then I think Yvonne Shapiro was saying the briefing may have been on education, may have been postponed to Monday. I'm not sure. I've not heard anything. So to answer an earlier, or just to put out there a question from Sha'ista earlier, what's the role of civil society at a time like this? And from most people I'm seeing, it's the need to monitor very carefully, be it everything from food to the registration of drug licenses, to the health system itself, to what's happening in our schools. Umunyana, would you agree with that?
I do. I completely agree with that. And I think that our normal business of holding power to account is called for now more than ever. So the work that we do, engaging with people on the ground, working with other CBOs to understand what implementation of these interventions and what the impact has been on their lives, and taking that information to the powers that be and holding them to their constitutional obligations. We shouldn't forget that even in a moment of crisis like this, we still have the constitutional framework that sets out rights and obligations of the state, and that they still have to progressively realize the right to health, for example, and do the work that they should be doing on infrastructure in schools. None of that should fall away. Whilst there is so much attention on COVID, which is important, I think as civil society, we mustn't forget the work that has to be done around accountability. And the president last night talked about greater transparency. And I think we must hold government to that. We need to see the basis on which decisions are being made, so that we're not having these silly debates, as Francois has said, about which clothes we can buy and can't buy. But we should be having debates about whether or not community health workers are being protected and have PPE available to them, and where all of this money is going. You know, we have billions now sitting in the Solidarity Fund. This is public money. We need to understand, we need to have access to information about the spending of those funds towards COVID, but also ensure that government is still spending at a provincial and local level to ensure that people are still getting services, that people's lives are still continuing to improve, despite the fact that we have a crisis. And I think that the scientists as well have called for the kind of modeling data that government is relying upon. And I think we have so much expertise in the country that we should be relying on. And I think, as the president says, government needs to take us into confidence, release all of this information so that we can engage. Civil society is not here to be anti-government, as we're often accused of, or to go to court all the time. Part of our role is to engage with government as well, but we need the ability to do that through accessing this kind of information. Ferial?
Thank you. Thanks very much. So, Francois, question for you from Sasha Stevenson. Do you think that we have lessons to learn from HIV in relation to civil society researcher cooperation? And if so, where would you start?
Yes, I think there is, and I think it links to the previous point about transparency. Is we need to know who are these scientists who are advising government, what are their names, and what are the decision points that they're talking about. And civil society, I think, needs to be making more of a noise about this, and I include myself around this.
Yes.
We need that radical transparency from the president. You know, it's all very well to stand up and apologize for what I'm not quite clear yesterday.
Yes.
And I have tremendous amount of respect for him. But we need to know when we make these massive social agreements around extending lockdowns, about solidarity funds and where the expenditure goes, what are those points and those discussions around that? And that's where civil society and science need to come together. I'm very concerned at the moment that we've been told the country is being lauded for the scientific approach to the crisis, when I don't know who these scientists are. I'm supposed to be one of them, and I wasn't asked. You know, I was kind of advising on things like masks and which drugs we use in ICU and things like that. But the big decision points are complicated ones that, you know, there's no reason for government to be keeping it quiet.
So you feel like there's a transparency need, because I also don't know. And as journalists, I must tell you, communication is very one way. You get to ask questions, they may not be answered. It's really like a broadcast from government, not a conversation at all. And you clearly feel, I thought you were on that panel in those meetings all the time, huh?
I am, and I can tell you that some of those discussions and those decisions were made completely, was more, again, similarly, we were just, and I'm probably breaking every confidentiality clause on that meeting, that we were informed of it, not asked for our opinion on it. Now, we're not the only group advising. It's very important to understand. We're not like the super scientist group. But a lot of the scientists I know are in that group are equally worried that, firstly, for the lack, we don't know why these decisions were made. I certainly was not given the chance to give input on, say, extending it to two more weeks, or to extend to go, or de-locking this down to phase 4 and phase 3. And this is why I think people need to be asking repeatedly, what are the criteria? What are the scientific reasons? We may disagree with them, and we may disagree with who's been asked or what those decisions are at the end. What I don't think is acceptable is being told, just trust us, we're government. I think we've had, we talked about the capable state. The state has to prove that it's capable. And at this stage, keeping information from us is not reassuring anybody.
So from Margaret Stafford and from Russell Rensburg, both saying civil society needs a seat at the table, and I'd argue at many tables. So at the Solidarity Fund, at all the bodies which are advising this awfully named thing called the National Coronavirus Command Council. Definitely lots of work, but time's nearly up, and I thought I might end with a quote from Rebecca Solnit in The Guardian this morning. She says, "The great majority of people in ordinary disasters behave in ways that are anything but selfish. And if we're stuck with veneer as a metaphor, then it peels off to reveal a lot of creative and generous altruism and brilliant grassroots organizing. With the global pandemic, these empathic urges and actions are wider and deeper and more consequential than ever." And Sha'ista, just a last word to you, because we haven't heard you for a bit. Is that something you've witnessed? Do you agree, perhaps?
Sorry, Ferial. I had a bit of a technical blur.
Oh, no,
you just...
Sorry. No, it's just it's a great quote on brilliant grassroots organizing and creative and generous altruism. Anybody who agrees that we've seen such a thing recently?
I think from my perspective, it's definitely something that's come up. And I think a lot of people have come to the party, whether you're talking about sort of community organizers trying to put together food hampers for people that they know, or whether you're talking about big businesses providing donations. There's been a lot of people coming to the party. There's been rising from the grassroots. And I think more importantly, there's been a lot of consideration for what other people are going through, whether it's people in your family or your neighbors, or just a sense that people are becoming a much more attuned to the needs and suffering of others. And I'm hoping that in going forward, a lot of this remains, and the sort of idea that people are concerned about the poor and the disenfranchised isn't something that's just a way to get more jogging done, but that's something that sort of feeds through into the kind of leaders we select, the kind of things that we lobby for and focus on. So hopefully that will happen.
Thank you very much. So thank you, Professor Francois Venter. Thank you for your leadership, Umunyana, Rugege, Advocate Thabang, Pooe. Wonderful to know that you're watching education with such an eye for us in Sha'ista Goga. Thank you for your great thoughts. Yes, to the next year, next 10 years, Section 27, you are certainly going to have your work cut out for you, as you always do. Happy birthday, and thank you to everybody who joined us. Have a great day. Bye-bye.
Thank you. Thank you. Thanks, everyone.
Thank you.